Manchay, Peru. Jocelyn, 15, has cerebral palsy. Ronald, Jocelyn's father.
The pandemic caught us by surprise. We lived with that fear. Even when we went to the market, we were afraid of getting infected, because Jocelyn's immune system is compromised.
Karina, 15, is blind.
Going from in-person classes to virtual was very hard. Teachers didn't know how to send me my homework or send me their classes, and my grades started dropping.
Belen, 11, speaks in sign language.
I was very bored during the pandemic.
Jose Maria Vieira, International Disability Alliance.
An organization of persons with disabilities is an organization that is led by persons with disabilities. OPDs are important always because we know what is best for us. But in time of crisis, this idea of nothing about us without us is even more important, because we know where we live, we know who we are, we know what we need.
Giovanna Osorio, Kipulaxta, Organization of Persons with Disabilities.
People with disabilities are not vulnerable because of their disability, but because of all the barriers they face in this society, which make them even more vulnerable in emergencies.
Rosa Maria Juarez, Commission of Blind Women.
During the pandemic, OPDs realized we had to get involved with the government. Before the pandemic, there wasn't much communication or engagement with the government. We started knocking on the government's door much harder.
We realized that communications about how to protect against COVID-19 were not accessible to everyone. People were sharing their concerns with us. They didn't know how to protect themselves. So we started preparing messages that were accessible to all.
Presidential messages started to feature sign language. Videos with prevention messages featured audio description and subtitles so they could be understood by people with hearing and visual disabilities. On April 2020, Law 1468 was passed, and this law ensured that people with disabilities must be allowed to work remotely, that they can't be fired from their jobs, and that reasonable adjustments be made for people so they can work from home.
Doctors arrive at Jocelyn's house.
I'm going to give you a vaccination, okay? Easy. Easy. There we go. That's it. Well done, Jocelyn.
We advocated for anyone with a disability and their main caregiver to receive priority vaccinations. Firstly, because people with disabilities sometimes have comorbidities. But another reason is because disability is often an indicator of poverty. If those people get COVID, they'll have less access to health care.
Brian Russell, Down Syndrome Society.
It was a bit of a battle to raise awareness, to make people take notice, and give us priority. But it worked.
In the area of education, there was a remote learning platform, and we made sure that it was accessible.
Ilda, Jocelyn's mother.
I've wanted Jocelyn to get an education since she was 5. None of the schools here would take her.
Liliana Peña Herrera, Down Syndrome Society.
In terms of education, something happened that we didn't expect. Children who previously weren't able to walk to school, for the first time, had the opportunity to learn from home.
When she heard she was going to have class, she was happy.
When she wakes up, the first thing she asks for is the tablet.
Rosangela Berman-Bieler, UNICEF.
UNICEF is looking at the way governments are engaging with OPDs, and UNICEF found Peru as an excellent example of this type of collaboration. And it is really a model that could inspire other countries to do the same.
Many of the things that were done because of the pressure and the activism of OPDs and families, in response to the problems they were having, which the government couldn't see.
Governments should not wait for organization of persons with disabilities to reach out to them. Actually, it should work the other way around. Persons with disabilities are disproportionately affected by this type of crisis. If governments do not wait and reach out to organization of persons with disabilities, we can also be part of the solution.
We've been lucky that since the start, public and private decision makers have taken us into account. We could tell that a lot of them wanted to do the right thing, they just didn't know how. And that's where they can sometimes mess up.
I think that when we are consulted, we can really achieve things.
Together, we can fight to have our rights respected.
A lot has changed in our lives. We've lost family members, we've lost friends. We've lost a lot. But we've also gained. We have gained some things. It's not all bad. If there's something this pandemic has taught us, it's empathy.
Everything is possible. With love, everything is possible.
This video was produced by UNICEF and the International Disability Alliance in the context of the global program supporting disability-inclusive COVID-19 response and recovery at national level, supported by the United Nations Partnership on the Rights of Persons with Disabilities Multi-Partner Trust Fund. UNICEF, for every child. UN Partnership on the Rights of Persons with Disabilities, International Disability Alliance. With special thanks to Wama Kuna Hope, an organization working with children with disabilities and their families in Manchay, Peru.